politics, business, sports, arts, music. Mike and Marty on the feed. Mike and Marty. Mike and Marty on the feed. Mike and Marty. Mike and Marty on the feed. Mike and Marty.
Good morning, Bellows Falls and Keene, and welcome to the feed. It's Mike and Marty. Here we are today. I'm supposed to go up to 80, I hear. It's going to be a fantastic day.
I know, and then I think they're saying 40s next
here.
week. Something like that.
We're here today with Dr. Venable again,
Right.
and we're going to be talking about chiropractic. But first, Marty with local events.
Local events. First of all, I want to give a shout out to all of the Wild Goose players and all of the people that helped with the performances the past 2 weekends. The ushers, the lighting people, the spotlight person, the sound people. It was a wonderful performance. It brought a ton of people to town. There was a huge buzz about it. So take pride in the work that you did. It was awesome.
Yes.
So now we are back to normal movies at the Bellows Falls Opera House. It's running from the 18th through the 28th, so you have plenty of time to see it, is the Super Mario Galaxy movie, which I know nothing about, but I'm assuming
It's
the
about
age
Mario
group,
and the
the age
galaxy.
group that is geared toward knows everything about that. The classic movie this evening is The Land Before Time, a Steven Spielberg, Lucas Spielberg classic. And I didn't look up to see who was sponsoring it. I apologize. This Friday at the Bellows Falls Union High School is a Fearless Futures Fair. It's a job fair for the high school students. It's from 9 a.m. to 12 p.m. If you have any interest, I think it's probably maybe a little late to have a booth, but maybe not. If you have any interest, you can reach out to Heather Warius, and she can get you set up. It's for high school students to figure out what they might want to do in their future. Happening this Friday night at the Bellows Falls Opera House is the second of the Ray Masuko concert series. Garrison Keillor is back. He came a couple of years ago, did a special, I think he did a Sunday afternoon and Sunday matinee one that year. This year he's doing an evening performance. I went into the concert, or I went into the event having like no idea and not actually being that psyched for it. He was hysterical. It was funny. It was relatable. It was funny. It was awesome. There are still seats available, so I suggest if you're interested, you go to the Bellows Falls Opera House website and grab a seat. And then this Saturday is the third Saturday of the month, so it is Legislators at the Library on the upper level of the library from 10:30 a.m. till 12 p.m. Michelle, Leslie, Wendy, and Nodder. They sit in a roundtable discussion, and they'll talk about what's going on at the State House, and they'll answer your questions and try to help you if you need some help.
Great,
everything.
thank you. Well, Dr. Venable, thank you for coming on again.
My
Yes,
pleasure.
we're
It's
excited.
nice to be back on this side, I guess, of the television screen.
And you're celebrating a milestone.
Yes, it has been officially a year since I've taken over the practice.
That's awesome.
So I made it, got it through taxes. And yeah, it's mind-blowing.
So you've settled in. They say if you've done something for a year, it's like now it's a habit, right?
I mean, I've heard from some other people that own some businesses that they felt like it took them about 3 years to get settled
really?
in.
Yeah.
But I mean, I don't know. I'm still going through it. But I feel like I am starting to get more comfortable. Whereas before, I think there was a little bit of shock of like, oh, I have to do that. I have to do that. And I'm like, oh, there's always stuff to do. Got it. Okay.
Finding a little more of a groove.
Yeah, I recently actually, or maybe sadly enough, have just done a weekend where I had one day that I carved out to myself, and I was like, okay, today I'm not going to do anything. And it felt surprisingly good.
I bet. Oh my gosh, I bet.
After a year of working 24/7, 365, yeah.
It's a marathon.
Yeah.
But you're seeing like light at the end of the tunnel. You're seeing it get like the overwhelm is less. Is that?
Yes, I feel like I've gotten into a bit of a groove and I'm not as overwhelmed. I feel like I can kind of manage more of it. I think a lot of it is just acknowledging that there's a lot that I haven't really learned or really know. And I like to just kind of keep that in mind as I go, which unfortunately kind of brings on a little bit of anxiety, but
Yeah.
at least keeps me grounded in the sense like, okay, I have resources, I have people I can talk to.
It's tough to give ourselves grace.
Yeah.
It really
that
is.
tough.
You know, especially if you're kind of driven, it's hard to be like, okay, why don't I know all of this?
Yes. Yeah.
So, but if I always figure if you have a guy, if you have somebody that that knows it, then you're golden.
Yes. Thank you for Dr. Temple being that guy, because I'm like, all right.
Oh, true. You have Dr. Temple, so you have the ultimate guy.
I do. So I can just fall back and be like, hey, so what would you do if this happened? Not saying it happened, but if it did, like,
Just
throw out a hypothetical scenario. Awesome.
yeah.
Awesome. So we are coming into the spring,
Mm-hmm.
and we're coming off of a crazy long winter. And we had talked that maybe today we would give some people maybe some things to think about, so that maybe they didn't dive right into, spring activities and then get laid up and not be able to do summer activities. So
Right.
You want to talk a little bit about some tips, or how do you want to approach it?
Absolutely. Well, I mean, this is bad business for me to give away my secrets,
true.
but no, I'm just kidding. We're always here to help. So I guess I would kind of narrow it down to like maybe 3 factors. One being just like having limited range of motion, whether that be in just some essential movements like reaching, being able to kneel, maybe squat, maybe getting on and off of the floor. That would be one of them, limited movement. The second would be kind of picking up right where you left off. So if like you were training for a marathon or something up until fall, and then all winter you kind of hibernated a little bit, when you get back into it, there's a way that we should go about doing that would help kind of keep you safe. Mm-hmm. And then the third would be just not following all the advice that you see on TikTok or Instagram from whoever the influencer is. And we can kind of go into those in a little bit more detail. But there's just some nuance to that I think that people don't quite have the knowledge or the wherewithal to kind of make a really good educated choice, because it's not just because someone said so, it must be true.
Yeah, and it's also got to be appropriate for your situation.
Yeah.
And that's what's not being taken into account by that influencer.
Exactly.
Because they don't know you.
Exactly.
They're just looking for sponsors.
Exactly.
Truthfully.
Exactly. So yeah, and all that's just kind of based off of stuff that I see regularly around these change of seasons. So like, I guess I can go into a little bit more detail so number one, kind of talking about having that limited kind of range of motion. I find that a lot of people tend to think that themselves that either I do manual labor on a regular basis, I run a farm, so I work out, so that's enough. And the misconception there is that those are just the movements that you do on a regular basis. And I don't think there's anybody, unless you're like a fitness trainer, that's really going through all of the specific motions. Yeah, exactly. So looking at it as like, if something is bothering you at the end of the day, that doesn't necessarily have to be because you did manual labor or because you're, you've had so many birthdays that, the doctor found arthritis in this spot and that's why it hurts. But kind of realizing that maybe there are some movements that you're not doing, and that you might need to check in with some provider that is specialized in movement to be able to kind of assess what are you not doing and get those tools underneath your belt.
And what are you not doing well, right?
Yes.
Because doesn't our body, like you talked about some basic movements like getting up off the floor and kneeling and squatting.
Yes.
Our body is kind of really good at helping us figure out how to do it, but not always in the proper movement pattern way.
Right.
So that's one thing that talking to someone.
Yes.
Because especially getting up off the floor, I remember I used to challenge my classes to do that, like try to do it without your hands or try to do it with minimal, because that is a key one as you get older.
Yeah. I have a patient actually yesterday that came in, and we weren't directly treating this at the time because we're talking about something in the neck, and he's like, oh yeah, by the way, like I can get my shoe on my right foot, but now what I have to do with my left foot is I have to go on the stairs and I have to sit up on the stairs a little bit, and then I can get my sock around the tip of my toe, and then I can kind of slide it in. And I'm like, that's a lot of extra work to get your socks on. And he's been doing this for months, and I'm like, okay. And he's like, well, I think it's my back. And I was like, probably not. Like, having already looked at his back in the past, I'm like, that's not a nerve issue. It's a movement issue. And For him, in a quick assessment, I was like, oh, there's this muscle in your hip that you need in order to create that deeper flexion. And without it, your body's going to kind of compensate and you get this tension in another spot that's compensating. So like, we just have to kind of focus here, get you doing this movement, because, you know, if it were purely nerve or even a mobility issue, then especially because, I mean, we're not talking about this person specifically, but there's a gut there. So, and sometimes we chalk it up to like, oh, I've gained more weight and that's why I can't reach my toes. And I'm like, but if you can do that on the right, then you should be able to do that on the left.
Yeah, there's a restriction. Is it like a restriction?
For this person, it was a muscle imbalance. So another, I mean, we're not talking about this specifically, but another like kind of pitfall is that a lot of people get, like, I'd say almost trapped in this idea that this muscle's tight and part of my routine is that I must stretch this muscle. And the truth is that usually if there's a muscle that's chronically tight, it's usually, can't say all the time, but usually compensating for weakness elsewhere. So the problem isn't that you need to stretch. The problem is that you need to discover where you're weak and why that muscle's wound up tight, because essentially it's working overtime, not getting paid. So eventually it can get upset, you can get inflammation. So more or less dealing with that weakness is actually going to help resolve the tension, and then you don't need to do the stretch anymore. And that goes into the same kind of concept of basically people getting
And are those
trapped.
things exacerbated when you, like you're in the winter and you sort of get into a routine that is repetitive, but maybe not as high level? And
Yeah.
so-
Yeah, exactly. And even if that routine happens to just be sitting on the couch.
I was gonna say, my routine wasn't high level at all. It was like recliner on the couch, binging Netflix.
Exactly.
So then to think all of a sudden I'm going to go back
now it's spring and I need to get out and I need to walk and I need to ride my bike and I need to do this and I need to
Exactly. And that kind of feeds right into that next concept, which is just the whole picking up where you left off. If you were like doing whatever you were doing throughout the summer, but there was like, you know, a 3-month hiatus, you shouldn't be trying to go for the exact amount of weight that you were lifting before, the same distance, the same speed. You've got to imagine that you've just gotten back to it for the first time and you got to dip your toe and then slowly ramp yourself back up.
Is the good news part of that though, so say you were at like, I don't know, level here, right?
Yes.
When you ended and you have to start, and it took you, the first time around, it took you, I don't know, say 6 months, right? And then, so you're starting back out, but you've had this level, but you can't start out here.
Right.
So you start out here and you work your way back up. It comes back quicker than it
Yes.
initially did. So that's always the part that I think it's important for people to know. It'll come back.
Yes.
You just got to give it a little time. Not as bad as when you first did it, but it will come back. You got to, again, give yourself grace.
Yes. Yeah. The grace. And like time wise, if we're giving it like a ballpark, it takes about 3 to 4 weeks for muscles to show signs of change. So if you're getting back into it, probably start light for that 3 to 4 weeks before you start going ham. Because sometimes people are like, oh, I did it for a week and then I bumped up my weights. And I'm like, your muscles haven't adapted to that first week yet. So go in slow. But most importantly, listening to your body. Pain is not normal. Pain is your body or your brain telling you that I don't like this. And that maybe there's something that we can tweak, not avoiding the pain, but addressing why it's there. Because those are warning signs.
And that was powerful. We were talking before and you said it's not normal to feel pain. And I think too often we just live with it, right?
Yeah.
You're like, oh, my back just bothers me because it does.
Right.
Or my hip bothers me or whatever
Right.
it may be. But a lot of times you're right. There's some underlying stuff that can be discovered.
Yeah.
And you can feel better.
Yeah.
There's like a, to me, that's a driving force.
Yes.
To try to, I don't like to not feel
Yeah.
optimal.
Yes. And be open to like even taking other people's advice too. I mean, I think sometimes we have our people that we trust, especially when it comes to physicians. And even me, like if you come see me for something, go ahead and like check in with someone else. See if we're kind of on the same page. Because for example, I have a patient who had hip bursitis. She had kind of identified with that diagnosis and that'd been for like 3 years. And when I assessed her, the bursitis wasn't there. Maybe it was there in the past. The other thing that she got hung up on was the image of the x-ray of her hip, where it showed some wear and tear there. And I'm like, well, we're all going to get some wear and tear. But overall, what was bothering her was muscular. It was a compensation that, like, once we kind of got the right muscles going, she was walking fine. She was even amazed that was even possible. She's like, I thought my hip was just so degenerated it wasn't going to be able to take that. And I'm like, yeah, we can't, again, just rely solely on the image. At least try out some other stuff. And know that arthritic pain tends to bother you when you first get started moving, and then it usually gets better. But if it's something that's like kind of getting worse as you do something, it's probably not arthritic pain. There could be something else in there that's more or less a compensation. It's a general.
And when you suss that out, you can give usually a pretty straightforward treatment plan for the most part, right?
Exactly. And the hard part's just sticking to it.
That is the hard part. That is the part where the patient has to buy in.
Yes. Yes.
Because you unfortunately can't wave a magic wand
No,
and do it for them.
No. And like, as much as I would love to be there to kind of show up and be like knocking on your door, it's like
you got overwhelmed.
Yeah, or people are like, I wish I can put you in my pocket, and I'm like, if you could pay my salary, I would do it, because I got loans. But yeah, I think having that motivation and reminding yourself that, especially if you have like a chronic issue, that if it went away at one point, that means you can probably get back to that point. And there are just normal ways of that progression where there's it's a rocky road. It's not always going to be smooth. But yeah.
And you slightly touched on this, but what about this? I think it's, I don't know what epidemic now is, information overload.
Yes.
It's like everybody has an opinion about something. And
then there's Dr. Google.
Yeah,
Yes.
exactly.
And now AI.
I mean, it used to be, I guess people would read a book or get a magazine article or something,
Right.
and then Google came along.
Right.
But now it's even gone beyond that. It's gone to influencers and AI. And how do you recommend people sort of charter a path through this?
I would say be humble and understand that, I have patients that come in more and more in the last few years that are like really convinced that they already know what's going on with them when they come in. And they're talking to me about the diagnosis. And I'm like, no, that's my job. You just tell me about the symptoms.
I'm so that patient. That's why I'm laughing over here.
Okay, that's okay. But at least be open to the idea that, like, I wouldn't come to this job and be like, you know what, I know stuff about cameras. I know what angle I should be looking at. I have no idea what I'm doing. And even if an influencer says, like, this is their top 5 things for back pain, one, it's individualized. There are different phases of healing, and to know which one you're in and to know the actual diagnosis and what is and isn't appropriate is so individualized. There was a period when I was working in New York where I didn't have like a marketing budget, so I just did Instagram. And one of the things I refused to do was those videos of, this is what I do for back pain, because it's just not fair to the person and the individual. And then aside from just being humble about how you're approaching these situations, you should check in with someone who knows more than you and figure out what is going to be appropriate. It's okay to have that information. It's okay to have some background in fitness. But I think that when we think about experts, a lot of what defines that is time and the wisdom and experience. And I don't even consider myself an expert. I'm too young, but I do have time and experience with treating these things and just being able to
training.
Yeah, informal training. That does count for something other than Dr. Google, but just to make sure that we put the right stuff in the right context.
Right.
When we're approaching these things.
Because again, the folks that are doing that, they're more interested in the sponsor market a lot of times. Not everybody. There are definitely some that just genuinely want to give out some tips.
Yes.
And I think usually there's a disclaimer. They're just trying to be helpful, but they don't know your case.
It's true.
So meeting with someone personally, again, you get you get to give that back, or you get to find out, is this appropriate for me?
Yes. And
that should always be the first question, right? Is
should
this
be the first
appropriate for me?
question.
Whether
Yes.
it's nutrition, fitness, whatever.
Yes.
How to mow the lawn properly. I don't know. Is this appropriate for me?
And there's even bias in AI as well. Like, I mean, depending on how you phrase your question, it can kind of gear you more towards one way or the other. And, these systems, they're not perfection. It is an automated system that's just collecting information and dumping and regurgitating that back out. But that doesn't make it true again for the individual, unless you're. I mean, you shouldn't do this, but unless you're putting in your whole medical history,
Do not do that.
right? And even still, it's a program. It's not a person. It's not touching you. Another recent reference to myself was I saw a patient this morning where, they explained what was going on with them. I had an idea of what was going on, and I had to stop myself from having that ego moment of like, oh, I know what it is. I'm like, you know what? I have an idea of what it is. I don't know exactly what it is because I have not touched it yet. I haven't looked at it. So we'll wait on that explanation. Let's assess it and figure out what it is before we just assume. So it kind of assume that a lot of this information is making a lot of assumptions for all these people.
Right. Yeah.
Yeah.
Crazy. Now, last time you were here, one of the tools that you talked a little bit about, and I don't think we had time to go into it, was the red laser.
Oh, yeah.
Yeah. Laser therapy. Tell me, I'm intrigued. Tell me more about that.
Well, I also want to make a correction because there was one statement I made last time about cancer kind of being the most or the only thing that was contraindicated. There are a few other things.
Okay.
I would say that I can't even list them all out verbatim, but like there's like implanted devices, in some cases autoimmune disorders. So it's a case by case situation, but it is really cool.
So you should go to you and not the influencer on TV that's selling it.
Correct.
There we go.
Yes.
Okay, good
Come
to know.
me at Temple Chiropractic in Bellows Falls. Working with someone who's actually certified to have that deeper understanding. There are a bunch of different approaches to these things. There are also a bunch of different intensities to these kinds of units. The ones that you can get at home, like that's dishing out maybe about, let's say the wattage that or power that would allow you to accomplish something in about, say, 20 minutes. The laser I have could do that in about 2, which is kind of cool, but with great power, responsibility. Essentially, it's an accelerated healer, and a good way to kind of just phrase it at that point. And I've been working within the bounds of, let's say, research and different protocols to just exploring other things that it's kind of helpful for. I have a patient who had lost their smell since COVID for about like 5 years. And we've been working on a protocol with that. And that has been giving this person smell back more frequently, where there's episodes where they're like, I think I can smell this. It's really
interesting.
cool.
That is really interesting.
But there's so many things that it can do. But a lot of it still individualized. Not everyone's going to respond the same.
Right.
And it is experimental for a lot of different conditions.
That's cool.
Yeah.
So we have about 2 minutes, just about 2 minutes left. So let's do a quick run through of obviously where you're located, and then kind of what I think we did this last time, but I think it's good to reiterate it. What is like a new patient protocol? Like, how does that work?
Okay.
If someone was intrigued by something that you said, and they had some questions about the influencer that they were watching, so they want to go to an expert, how would they go about that?
Okay. So I am located in Bellows Falls at 33 Route 121. You can call the office at 802-463-9522. It's a good test there.
Yeah, I was going to say, I was looking to make sure I had to write it down in case you,
Yeah, every now and then I'm like, is it 603? But it's 802. You could follow me also on Instagram at The Venerable Doctor. And you could also check out our website at templechiropractic.org. But all of that would just be information. You would call the office, speak with our front desk person, provide them any information that you have around your insurance or payment, and we would get you set up for at least an exam. During that exam, we'll talk about what it is that you're coming in for specifically. My goal is to kind of be more patient-centered, so it is a team effort, and your goals are important. So we'll talk about those goals. I'll also go through the exam with you, and then I'll also explain what I'm finding, so that way you understand what's going on with your own body, because I think the results are better when you understand it, and I always encourage people to ask questions.
And then if you understand it, you have more buy-in too.
Exactly. You'll understand like what things are going to make it worse and what things are going to make it better. And then a shameless plug is that you could also keep an eye out for me doing a cabaret show here and there and around the area.
I think that's awesome.
I think actually we need to have you come back sometime and without the doctor hat and talk about cabaret, because I'm fascinated.
Okay. Yeah, I would love to.
I think that would be great too. I think especially if you're going to do one local, we can help promote it.
Okay.
And the whole bit. But I think
rumors of one this spring.
Possibly coming this summer. And
Summer, okay.
maybe in the center of town, but if you
That
follow
would be
me
so
on
cool.
Instagram, you'll find out. I don't want to put them out, but I think we're going to talk about it in May. So
All right.
Awesome.
Yeah.
So just to remember, to remind everyone, it is not normal to feel pain.
Yes.
So if we can,
Yeah.
if we can leave with that thought, and then
Yes.
that might plant some seeds of people thinking,
yes, and at least try the basics. Yeah. Ooh.
awesome. Okay, we have run out of time.
We're right out of time. We'll see you next
Bye,
week
community.
on the feed.
Yeah.